Happy Football Jersey Friday, Kudzai.
Happy Football Jersey Friday, Dr. B.
All right, it's been a couple weeks since I've been here, but Dr. J is on site adjusting today. So it is me and Kudzai here holding it down, ready for you guys to show us what jerseys you got. It's funny, we actually saw a couple this week. One was a Vikings fan, one was a Redskins fan. So as a Packers fan, losing to, or being behind the Vikings and playing the Redskins this week, it was kind of just a real shot to my soul. But anyway, let's talk about prevention today. So I kind of briefed him a little bit before this, but I haven't heard his answers yet. So when I say the word prevention, what do you think of, Kudzai?
When you say prevention, for me, it means something that's not reactionary. So you try to avoid having to deal with something later, i.e. stretching before you exercise so that you don't get injured and then have to deal with the injury afterwards.
That's a good, yeah, and honestly, exercise is a form of prevention as well.
Exactly.
Now, the reason it got brought to my attention is I actually had a patient this week come in and say that their insurance plan was changing, and they were really excited about all the preventative aspects of it. And they started naming some of the things that insurance companies consider prevention. Mm-hmm. And I thought it was really interesting because a lot of them weren't, in my opinion, prevention. I think there's a difference between diagnosis and prevention. Mm-hmm. For instance, if you go in to the doctor for a prostate exam, right? If you don't have inflammation in the prostate, you don't have prostate cancer, correct? Mm-hmm. Is that preventing prostate cancer?
No, it's not.
No. And if vice versa, if you went in and they found inflammation on your prostate, mm-hmm. that is at the very severest, that is prostate cancer. It could be something else too. Mm-hmm. But is that preventing anything wrong with your prostate?
Nope.
So, unfortunately, a lot of things that are considered prevention are not prevention. It's either, hey, you're doing good, or hey, you have something wrong. Yeah. It's not, let's make sure we increase fiber, or let's make sure we work out more, or let's make sure we get more omega-3s, or something that could possibly influence the prostate if you think you're prone to it. That would be prevention. To me, prevention is always something that is going to prevent something, not just something that can diagnose it.
Yeah, that makes sense.
Yeah. And it's kind of a pet peeve of mine to think of diagnosis as prevention, but, for some reason, insurance companies do it all the time. So I always bring it back to chiropractic a little bit. In what way, gotta switch arms there, I'm getting tired. In what way do we prevent things here? So we go to kind of our wellness plans, and even the people that are coming in on our lowest recommendation of one time a month to get checked, what do you see in those types of patients, Kudzai, the people that get checked once a month to see if they have any subluxations or any irritation in their nervous system?
What do I see? Well, we're still keeping it prevention related, right?
Yeah, or just anything in general. We'll talk about prevention in a second here.
Well, one thing that I see out of people who come here even once a month is, I see those people complaining about getting sick way less frequently than your average person. That's number one. Two, I noticed that the fact that when they do come in for each adjustment, they are really aware of what's going on with their body because they're used to being well and being aligned and not having subluxation, so they are more aware of their health and their wellness. So it kind of, I feel like it helps you health-wise, and it also helps you to be more keen of what's going on with your body.
Yeah, I would totally agree. I think even a small preventative aspect of a once a month adjustment would make a big difference in a lot of people's lives, just immune system wise, or even just awareness of kind of, hey, you continually have these types of subluxations. Let's talk about diet. Let's talk about posture. Let's talk about physical stress, to possibly prevent something from happening in the future. Mm-hmm. And me and Dr. J were talking about this the other day. The sad fact is there's only about 4% of the population that has ever seen a chiropractor, and about 1% that currently has a chiropractic visit on the books, their next one. Can you imagine what it would be like if everyone in the country, everyone in the state, everyone in the world had a once a month adjustment. It's kind of crazy to think about the preventative aspects that people would get, but it's also kind of crazy in the fact of there would not be nearly enough chiropractors to handle that volume.
That's true.
You know, I always hear, oh, there's chiropractors everywhere. You know, Fort Collins has somewhere close to 200 chiropractors. Even in a small-ish city like Fort Collins, 200 chiropractors wouldn't be able to handle everyone getting adjusted once a month.
That's true.
So it kind of puts things into perspective of if people did pay attention more to prevention. I think things like chiropractic, things like nutrition, things like organic food, things like the gyms around here, everyone would have to expand.
That's true.
And get more employees, and I think that would be the best stimulus the economy could ever have.
I agree. I also think there'd be a major paradigm shift also, like if let's say 60% of the population got adjusted once a month, I think things like the flu season would be eradicated and the flu vaccine would be gone because there wouldn't be a need for it. You know,
yeah.
even simple things like that.
And those would all be great points, and I think you could do some awesome studies on it. Just it would be a fun study to do, actually, and see what's going on. So I know this was a little long on Facebook Live here, but we're here for Football Jersey Fridays. We're your jerseys. We'll talk about prevention all day long. So we will see you later, and have a great weekend.